Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. The CPT code 72020 is used for a radiologic examination of the spine with a single view. This code applies to any section of the spine, cervical, thoracic, lumbar, sacral, or coccygeal, as long as the report documents only one view. Now here's something important about this code. The guideline does not require a specific view, AP, lateral, or oblique. What matters is that only one view is performed, and it is documented in the report header. This rule applies to all spinal regions, from cervical to lumbar. Technical caveat: sometimes, the technologist may need to take two images in the same plane to fully capture the anatomy. For example, if the patient is large or anatomy is cut off in the first exposure. Report example: order location, ER, order date 12/6/2023, order exam, L-spine 1 view. Images, single AP view of the lumbar spine. History, injury. Comparison, lumbar spine radiograph 12/26/2022. Findings: impression, there is lumbosacral transitional anatomy with partial sacralization of L5, no lumbar scoliosis, intervertebral disc space loss and end plate sclerosis at L4-L5, similar to 12/26/2022, which may represent severe degenerative disc disease versus prior spondylodiscitis. No interval vertebral body height loss. Cholelithiasis. In this example, the exam was ordered as L-spine 1 view, and the radiologist confirms single AP view of the lumbar spine. This confirms a one-view lumbar spine X-ray, so 7200 is the correct CPT code. Here's what the radiologist documented in this case. Lumbosacral transitional anatomy with partial sacralization of L5, no lumbar scoliosis, disc space loss and end plate sclerosis at L4-L5, no interval vertebral body height loss, cholelithiasis, and the clinical history is injury. No acute fracture or traumatic injury is identified. Since this is an emergency room visit for a new injury, but no acute findings were found on imaging, you must follow ER coding guidelines. Incidental findings, like degenerative disc disease or congenital sacralization, are not coded in this setting unless they are clearly related to the current complaint. If no specific injury details are provided in the chart and the exam is normal, the appropriate ICD-10 CM code is 04.3 encounter for examination and observation following other accident. This code tells us that the patient came to the ER after an injury, imaging was performed, but no acute diagnosis was made. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.